So we will wrap up this chapter by looking at the female reproductive hormones and talking about the female reproductive cycle. So let us get started. Much as we, in exactly the same way that we saw in the male reproductive system, the secretion of female reproductive hormones is controlled by the hypothalamus through gonadotropin-releasing hormone, or GnRH. So as the hypothalamus releases or secretes GnRH, this stimulates the pituitary gland to release FSH, follicle-stimulating hormone, and LH, luteinizing hormone. Secretion of GnRH usually begins around age 10, and sorry, I've got a cat here that is now trying to get in the middle of everything, so that's all the noise you're hearing in the background. So secretion of GnRH begins somewhere around age 10, and after 6 months, or after a year or so, 6 months to a year of GnRH secretion, then menarche occurs as FSH and LH have their effects back at the ovary. Okay, so GnRH is the controller for the ultimate controller for female reproductive cycling, and FSH released by the anterior pituitary gland, and its action is at the ovary, and as a result we see the maturation of follicles and oocytes maturing as well. So FSH is all about the production of the the growth and maturation of the follicle and the oocyte contained within it. LH, luteinizing hormone, is released also by the anterior pituitary gland. It causes weakening of the membrane that covers the follicle, and it causes fluids to come flooding into the follicle, resulting in ovulation, the release of the oocyte. And it also acts at the ovarian cell to produce estrogens, and for some reason I left this out, and progesterone. Okay, and remember we talked about the idea that lutein means yellow, and so this is the yellowing hormone. It causes the ruptured follicle to become the corpus luteum. All right. Estrogens, these are produced by cells of the ovary. So we use that term estrogen as if it means just a single hormone, and there are a variety of hormones. 3 of them I've got listed here: estradiol, estrone, and estriol. There are more. And these are secreted primarily by the ovaries, but also a small bit is produced by the adrenal cortex. And during development, so as the embryo is developing, it is the production of estrogen that stimulates the formation of the primary sex organs. So the uterus, it causes the tissue that could become the penis if the child were male to become the clitoris. It causes stimulates the development of the ovaries from the epidermal tissues that are at the dorsal surface of the body. So we see all the primary sex organs developed as a result of estrogen production during development. And then at puberty, it causes the growth and development and then maintenance of the ovaries and other organs of the female reproductive system. So estrogen is the big maintainer of female reproductive activity. It also, at puberty, establishes and then maintains the secondary sexual characteristics these estrogens do. And so we're talking here about the development of breasts and all of the ducts and the systems of the mammary glands. And we also see increased deposition of adipose tissues, especially in the breast regions and also in the thighs and the buttocks. So this is the cause of the shapes that we associate with femaleness, with larger hips, with because especially widening of the pelvic bones, and also the deposition of fat tissues, adipose tissues, around the thighs and buttocks. And then we also see, as a result of estrogen production, increased vascularization in the skin. So epithelial tissues or the subcutaneous tissues become even more vascularized than they are during childhood. Progesterone is another of the female reproductive hormones. It's secreted primarily by the ovaries, and its effect is back at the uterus, at the endometrium. And so, as a result of progesterone production, the endometrial lining of the uterus becomes thicker and becomes much more mucus. We see greater mucus secretion as the endometrium becomes thicker, and the production of the secretions there become more rich and produce more electrolytes as well, in preparation for the potential of a zygote coming to implant in those tissues. It also has an effect at the breasts, as it readies the breasts for other stimulation, for stimulation from other hormones that we'll be talking about in when we look at Chapter 13, our last chapter for the year. And then it also plays some feedback at FSH, at the pituitary gland, to regulate the production of FSH and LH. So lots of effects from progesterone. So again, the uterus lining, the breasts, and then provides feedback around FSH and LH production. There are also androgens being produced in the female body. These, remember, are the male sex hormones. They're not being produced by the ovaries, though. This is secretion that is occurring from the adrenal cortex. And there is enough, beginning at puberty, there's enough androgen production to cause pubic and axillary hair growth. So we see hair in the armpits, hair in the pubic regions, but it's not so much that it causes broader shoulders and narrow hips, the characteristic shape that we associate with maleness. So enough to produce hair production, but not enough to change the shape of the body. All right, so those are the primary hormones that are involved in female reproduction. And now we're going to talk about the female reproductive cycle. Excuse me. So if GnRH production begins around age 10, then about a year later, menarche occurs. Menarche is the onset of the female menstrual cycles, and it usually happens somewhere between ages 11 and 12. So menarche occurs, and after menarche, there's a period of time where the periods may be very irregular and erratic, but relatively quickly the reproductive cycle settles down, and for the next 40 to 50 years, a woman will be doing reproductive cycling. So menopause is the last menstrual cycle, and it normally occurs between ages 45 and 55. So it's a broad range, but effects of the perimenopausal effects can occur as early as the late 30s. Women can begin seeing irregularities in menstrual cycling as the reproductive hormones begin to wane in the body. The average cycle lasts about 4 weeks, 28 days, but cycles from anywhere from 21 to 35 days are considered normal or appropriate. So lots of variability within how long the reproductive cycle lasts. And there are 3 phases or stages to the reproductive cycle. And so 3 stages. There's the proliferative phase, the secretory phase, and then a phase called, or a stage called menses. All right, so we'll take a look at those 3 stages. So the proliferative phase occurs as FSH and LH stimulation causes development of the ovarian follicles. And as many as 20 ovarian follicles may be stimulated in an ovary in preparation for the production of a single oocyte. So as these follicle cells begin to grow, that's the proliferative component of the descriptor here in the name of the as the follicle cells begin to grow and divide. These cells will also begin secreting estrogens, and so increase in estrogen in the body results in the endometrium, the surface layers of the endometrium, thickening as more and more cells are being produced, and it also feeds back on the follicle itself, causing maturation of the follicle. And so under the influence of FSH and LH and the estrogens that are being produced as a result, we see the follicle ready. Multiple follicles may be called into action, but only one follicle will come to complete development. And so that the chosen follicle then, somewhere around day 14, will be affected by a big spike in LH production. This causes fluids to come flooding into the follicle and results in the membrane that covers the follicle becoming weaker. The connections between the cells become less tight, and as this occurs, then the follicle will burst, releasing that secondary oocyte, and we call this bursting of the follicle ovulation. Under the influence of luteinizing hormone, the cells that remain in the follicle, so if we think about, this is the surface, the ovary, here are the cells that line the follicle. The secondary oocyte has been released, so it's on its way now to the uterine tube. LH causes these cells to grow and divide and to increase in size, and they fill up that space where the follicle was. And they begin, and this is what we call the corpus luteum here. This then begins releasing progesterone into the body. The corpus luteum does. Okay, so as progesterone and estrogens are secreted by that corpus luteum, then the secretory phase of the female reproductive cycle occurs. In the secretory phase, the endometrium is very glandular, and the uterine glands of the endometrium under progesterone production will increase in size, and begin to secrete a very rich mucus and lots of electrolytes that, if an embryo comes to implant, will nourish that embryo. But if there is no fertilization, the corpus luteum will stop production of progesterone somewhere around day 24. So if day 14 is ovulation, and then following day 14, we'll see an increase in progesterone. But about day 24, with no fertilization, then the corpus luteum will degenerate. And as it stops producing progesterone and estrogen, then the upper surface, let's see, so if this is the uterus now, coming down to the cervix, we have this thickened lining. The upper surface here, we'll see constriction of blood vessels here in the upper surface. So it had lots of blood vessels that were feeding it, but those blood vessels will constrict and cut off the blood supply, the nutrients to these cells. And what will happen as a result of having no blood supply? Well, they'll die. So we see tissue death. So I'll darken it. That's the tissue, the dying tissue. So tissue death occurs, and after about 4 days of reduced or no progesterone secretion, then this dead tissue begins to slough off. So it comes off and begins to flow out of the uterus and into the vagina, and then out of the body. If, though, the embryo implants into the endometrium, the embryonic tissues produce an important hormone called human chorionic gonadotropin, or HCG. So human chorionic gonadotropin, okay, now let's pretend that we've got a little embryo implanting here. It begins to grow a placenta. The placenta produces hormones, HCG, that feed back to the ovary, where the corpus luteum is. So HCG tells the corpus luteum, keep making progesterone. So the corpus luteum makes progesterone that feeds or that stimulates the endometrial lining to continue producing rich mucus and to maintain that uterine lining. So it's this HCG and progesterone conversation that's occurring throughout the 9 months of pregnancy that maintains the uterine lining. So no HCG, corpus luteum dies, and so does the upper layers of the endometrium. With HCG, the corpus luteum produces progesterone, and the endometrial lining is maintained. So the last phase of or stage of the female reproductive cycle is menses. So at about day 28, with no HCG and reduced progesterone, the endometrium lining begins to slough off along with blood from the damaged capillaries that have, so as the tissue breaks away, there can be more bleeding that occurs then. And as the blood and the degenerating tissues are lost at the vagina, we see menstruation. So day 28 is the end of the reproductive cycle, and of one reproductive cycle, and the beginning day of the next reproductive cycle. So menstrual flow marks day 1 of the next reproductive cycle. So we count the cycle beginning at day 1. So day 1, menses. So here's menses. About midway through the cycle, so on the average cycle, that would be day 14, and a 35-day cycle, it would be somewhere around day 17 or 18. We see ovulation, and then day 28 is the end of that menstrual cycle, and then we cycle back around. So here at menses, we're going to see the lowest production of estrogen and progesterone, and this low progesterone and production and estrogen production causes the anterior pituitary gland to secrete LH and FSH, which begins the production of a new follicle or new follicles. Okay, so there's the reproductive cycle. Some other effects that are going on during this time, or some other components of the female reproductive cycle or system, are the mammary glands. These are the glands that are found in breast tissue, and their function is to secrete milk to nourish the newborn infant. We refer to that process as lactation. Lact means milk. The ducts from the multiple mammary glands open to the body surface at the nipple. So if you've never seen a lactating woman, there are multiple holes through which milk comes there around the nipple and the areola of the breast. And all of this all of the milk production is controlled by hormones of both the reproductive system and the placenta. Thank you, Kat. And the placenta, the baby's tissue there inside the uterus. I'm going to allow you to read about birth control on your own, and about sexually transmitted diseases on your own as well. But be sure to read about both of these topics. There will be questions related to that on the exam. All right, so here we are. We've done with Chapter 22.